The mechanism of action of REZUROCK, belumosudil.
Indication: REZUROCK belumosudil is indicated for the treatment of adult and pediatric patients 12 years and older with chronic graft-versus-host disease, chronic GVHD, after failure of at least 2 prior lines of systemic therapy. Important safety information, warnings and precautions. Embryo-Fetal Toxicity. Based on findings in animals and its mechanism of action, REZUROCK can cause fetal harm when administered to a pregnant woman. Advise pregnant women of the potential risk to a fetus. Advise females of reproductive potential and males with female partners of reproductive potential to use effective contraception during treatment with REZUROCK and for 1 week after the last dose. Please see additional important safety information presented at the end of this video.
REZUROCK is an innovative therapy designed for the treatment of chronic graft-versus-host disease, or chronic GVHD. As a selective ROCK2 inhibitor, REZUROCK simultaneously targets both the inflammatory and fibrotic components of chronic GVHD. REZUROCK has a 100-fold higher inhibitory activity against ROCK2 over the ROCK1 isoform. In the chronic inflammatory phase of chronic GVHD, uncontrolled activation of Th17 and follicular helper T cells leads to extensive production of pro-inflammatory cytokines such as IL-17 and IL-21 and B-cell-derived pathologic antibodies. Within the naive T cell, ROCK2 interacts with and phosphorylates STAT3, leading to formation of the JAK2 STAT3 complex and upregulation of Th17 and follicular helper T cells. REZUROCK interrupts this process through its selective inhibition of ROCK2. This results in the decreased activation of STAT3, triggering the significant downregulation of both Th17 and follicular helper T cells. In addition, injury to the thymus from conditioning regimens used prior to transplant, immunosuppressant-based prophylaxis post-transplant, and other factors contributes to its inability to produce a normal amount of regulatory T cells. As a result, autoreactive and alloreactive T cells escape regulation and contribute to lasting chronic inflammation in chronic GVHD. REZUROCK promotes the interaction of ROCK2 with JAK3, which increases phosphorylation of STAT5, causing upregulation of regulatory T cells. The immunomodulatory effect of REZUROCK on STAT3 and STAT5 phosphorylation reduces the inflammation associated with chronic GVHD. In addition to the chronic inflammatory state that continues through this fibrotic phase of the pathophysiology of chronic GVHD, activated macrophages of the innate immune system produce growth factors that activate profibrotic mediators, such as LPA and TGF-beta. These mediators subsequently activate ROCK2, which results in polymerization of G-actin to F-actin. This frees the transcription factor MRTF and leads to transcription of profibrotic genes. The process leads to changes to the cellular structure and an increase in tissue stiffness, which are the key features of fibrotic diseases. Selective ROCK2 inhibition with REZUROCK prevents the polymerization of G-actin to F-actin, as well as MRTF-induced upregulation of profibrotic gene expression. This results in the ability of REZUROCK to downregulate fibrosis, as evidenced by the decreased collagen deposition around the bronchioles and the delayed progression of scleroderma in animal chronic GVHD models. In summary, REZUROCK restores immune homeostasis in chronic GVHD by downregulating Th17 cells and upregulating regulatory T cells. Simultaneously, REZUROCK downregulates the fibrotic processes of chronic GVHD. As an oral selective ROCK2 inhibitor, REZUROCK is an innovative therapy designed for the treatment of chronic GVHD.
Indication: REZUROCK, belumosudil, is indicated for the treatment of adult and pediatric patients 12 years and older with chronic graft-versus-host disease, chronic GVHD, after failure of at least 2 prior lines of systemic therapy. Important safety information: warnings and precautions. Embryo-Fetal Toxicity. Based on findings in animals and its mechanism of action, REZUROCK can cause fetal harm when administered to a pregnant woman. Advise pregnant women of the potential risk to a fetus. Advise females of reproductive potential and males with female partners of reproductive potential to use effective contraception during treatment with REZUROCK and for 1 week after the last dose. Adverse reactions. The most common, greater than or equal to 20% adverse reactions, including laboratory abnormalities or infections, asthenia, nausea, diarrhea, dyspnea, cough, edema, hemorrhage, abdominal pain, musculoskeletal pain, headache, phosphate decreased, gamma-glutamyl transferase increased, lymphocytes decreased, and hypertension. Permanent discontinuation of REZUROCK due to adverse reactions occurred in 18% of patients. The adverse reactions, which resulted in permanent discontinuation of REZUROCK in greater than 3% of patients, included nausea, 4%. Adverse reactions leading to dose interruption occurred in 29% of patients. The adverse reactions leading to dose interruption in greater than or equal to 2% were infections, 11%, diarrhea, 4%, and asthenia, dyspnea, hemorrhage, hypotension, liver function test abnormal, nausea, pyrexia, edema, and renal failure with 2% each. Monitor total bilirubin, aspartate aminotransferase AST, and alanine aminotransferase ALT at least monthly. Drug interactions. Proton pump inhibitors. Belumosudil exhibits pH-dependent solubility. Concomitant use of REZUROCK with proton pump inhibitors decreases belumosudil exposure, which may reduce the efficacy of REZUROCK. Increase the dosage of REZUROCK when used concomitantly with proton pump inhibitors. Strong CYP3A inducers. Belumosudil is a CYP3A substrate. Concomitant use of REZUROCK with strong CYP3A inducers decreases belumosudil exposure, which may reduce the efficacy of REZUROCK. Increase the dosage of REZUROCK when used concomitantly with strong CYP3A inducers. BCRP and OAT-P1B1 substrates. Avoid concomitant use with drugs that are BCRP substrates where possible. If used together, monitor patients more frequently for adverse reactions and decrease the BCRP substrates dosages in accordance with the respective prescribing information. Belumosudil is a BCRP inhibitor. Concomitant use of REZUROCK with BCRP substrates increases their plasma concentrations, which may increase the risk of adverse reactions related to these substrates. Belumosudil is an OAT-P1B1 inhibitor. Concomitant use of REZUROCK with OAT-P1B1 substrates may increase their plasma concentrations. Monitor patients more frequently for adverse reactions of these substrates and decrease the OAT-P1B1 substrates dosages in accordance with the respective prescribing information. Certain CYP1A2 and CYP3A substrates. Avoid concomitant use of REZUROCK with drugs that are sensitive CYP1A2 or CYP3A substrates, for which minimal concentration changes may lead to serious toxicities. If concomitant use cannot be avoided, decrease the CYP1A2 or CYP3A substrate dosages in accordance with the respective prescribing information. Belumosudil is a CYP1A2 and CYP3A inhibitor. Concomitant use of REZUROCK with sensitive CYP1A2 substrates, for example caffeine, or CYP3A substrates, for example midazolam, is predicted to increase CYP1A2 or CYP3A substrate exposure, which may increase the risk of adverse reactions related to these substrates. Certain UGT1A1 substrates. Avoid concomitant use of REZUROCK with drugs that are UGT1A1 substrates, for which minimal concentration changes may lead to serious toxicities. If concomitant use cannot be avoided, decrease the UGT1A1 substrates dosages in accordance with the respective prescribing information. Belumosudil is a UGT1A1 inhibitor. Concomitant use of REZUROCK with a UGT1A1 substrate decreased plasma concentrations of the glucuronide metabolite of the UGT1A1 substrate. Concomitant use of belumosudil with other UGT1A1 substrates may increase their plasma concentrations, which may increase the risk of adverse reactions related to these substrates. Certain PGP substrates. Avoid concomitant use of REZUROCK with drugs that are PGP substrates, for which minimal concentration changes may lead to serious toxicities. If concomitant use cannot be avoided, decrease the PGP substrates dosages in accordance with the respective prescribing information. Belumosudil is a PGP inhibitor. Concomitant use of REZUROCK with PGP substrates increase their plasma concentrations, which may increase the risk of adverse reactions related to these substrates. Use in specific populations. Pregnancy. There are no available human data on REZUROCK use in pregnant women to evaluate for a drug-associated risk. Advise pregnant women and females of reproductive potential of the potential risk to the fetus. Lactation. There are no data available on the presence of belumosudil or its metabolites in human milk or the effects on the breastfed child or milk production. Because of the potential for serious adverse reactions from belumosudil in the breastfed child, advise lactating women not to breastfeed during treatment with REZUROCK and for 1 week after the last dose. Pediatric use. The safety and effectiveness of REZUROCK in pediatric patients less than 12 years old have not been established. Geriatric use. Of the 186 patients with chronic GVHD in clinical studies of REZUROCK, 26% were 65 years and older. No clinically meaningful differences in safety or effectiveness of REZUROCK were observed in comparison to younger patients. Renal impairment. Treatment with REZUROCK has not been studied in patients with pre-existing severe renal impairment. For patients with pre-existing severe renal impairment, consider the risks and potential benefits before initiating treatment with REZUROCK. Hepatic impairment. Avoid use in patients with moderate hepatic impairment, child Pu-B, or severe hepatic impairment, child Pu-C, without liver GVHD. No dose adjustment is recommended for patients with mild hepatic impairment, child Pu-A. Please see full prescribing information at the adjacent link or at REZUROCKHCP.com.